Do you know what a heart attack looks like and at what point you need to rush to the hospital? That's the question I asked today. My guest is Dr. Kaushal Pandey. He is a very respected cardiothoracic surgeon with over 35 years of experience. He has experience specifically in open heart surgery, in bypass surgery, in valve replacement, but he's been very kind to give us time and to answer all of our really basic questions on how we can keep our hearts healthy, how we can protect ourselves from cardiovascular disease, and what to do if someone is having a heart attack. This is part of our collaborative conversations with PD Hinduja Hospital and Medical Research Center. Take a look at this entire conversation where we talk about how to keep your heart ticking. Dr. Pandey, thank you so much for making time to speak with me. I know that you're a very busy man with 32,000 surgeries under your belt. So I appreciate the time that we're talking. I've divided our conversation into three halves.
Yeah.
We could talk about heart health and prevention, and we'll talk about various forms of treatment that are available for someone who does have a heart problem.
Sure.
And then recovery and taking care of your heart, even after you've had an episode of some sort. So if we start with prevention, as charming as you are, how do we avoid seeing you and take care of our hearts as God has given us? So
Sure.
we hear more and more stories of younger people having heart episodes right now. In your experience, are you seeing the age pattern change? You've been at it for 35 years now.
Sure.
Are younger people coming to you?
Sure. My pleasure to be here this afternoon, and I'm sure we'll have a great conversation. Yes, 35 years of practice is a very long time in anybody's life. I started my career at the age of 34. That means 1 year more than my career now in practice, and 32,000 open heart surgeries done. A lot of things have changed in the last 32 years. The pattern of disease has changed, the age group has changed, the practice has changed, the society has changed, the quality of life has changed, the food that we eat has changed. And all this is coming at a very heavy price. Why? Because just as I started my career, I sacrificed everything in my life. I was very avid badminton player. I just stopped. Believe me, in 91 when I started, every day morning I was doing a 10 kilometer run and then go to work. Till I became very busy, so that stopped. And for next 15 years, running went for a toss. I just stopped running. I used to play badminton twice a week. It became once a week, and that eventually stopped as well. So what is happening in our country, because it's a developing country, all of us are pursuing careers. All of us are aiming to be there. Not all of us will reach there, but a lot of sacrifices happen. And all these sacrifices are taking a major toll on our health, because career, and so everything else gets second-rate treatment. So that's the harsh reality of life. Nevertheless, what can we do about it? So let me address the first question. Has the pattern of disease changed? Yes. In 91, when I was operating on a 70-year-old, my colleague came and laughed. You're a mad fellow. 70-year-old, you're doing a bypass surgery. This is true in 91. I said, no, he will live for another 15, 20 years. But he's an old man. And those days, most of our patients were 50 to 70. 2026, the pattern is so different. We have patients now coming at the age of 16 for a bypass surgery, and 92 is the oldest man that I have operated. So today the pattern has changed, everything is different. The commonest age group that everybody wants to talk about is that 40-year-old. He goes to gym, comes out of the gym, somebody hands him over a glass of juice, and few seconds later he drops dead. And the family says, oh, he's a gym freak. But you are not realizing what other things are going wrong. He's also like one of us, pursuing a career. But he now wants to do a gym because he wants to look very good. He wants to have a very sound physique. And what is he doing? Apart from overdoing the gym, a lot of these gentlemen are also overdoing anabolic steroids. So to develop big biceps and big pectoralis, you resort to whey protein and you resort to injections of steroid, because the gym instructor says, I can make you like Arnold Schwarzenegger in 3 months' time. Why not? I also want to be Arnold Schwarzenegger.
Hang on. Are you saying whey protein is bad?
Yeah, so what happens is this commercially available whey protein, for people to develop good muscles, some anabolic steroids are added to that as well. So when you buy your whey protein, be very, very careful. So how would you ask one? Go to the chemist and ask for medical grade protein, medical grade whey protein. Then that fellow becomes cautious. He knows he can't sell you one of those anabolic steroids. It's very important. Why? Because anabolic steroids are good, but they increase the metabolic rate very high. That's how you develop muscles very quickly. But it comes at a cost, because the whole body now has a higher metabolic rate. You could be having 60-70% blockage, which you are not aware of because you have not done any investigations. So that is also where society has gone wrong. When a 40-year-old wants to join a gym, he or she should have a stress test done. Ensure that you are medically fit to undergo vigorous exercise. And that isn't happening. That isn't happening. So that is one problem. Second problem is a lot of youngsters, without the knowledge of even their spouse, sometimes are smoking away. And that's not good. Tobacco in any form is extremely harmful. And then they will say, I have only one cigarette a day. There are a lot of parties now, you go and see expensive cigars. The smoke in a cigar is not only highly carcinogenic, but the amount of nicotine it is carrying is phenomenal. It's like 25 cigarettes in one shot. So this is provoking heart disease in a youngster at a very young age. The other thing which has gone wrong with us is today people are developing diabetes at a young age, like 30-35. 35 years ago, people were developing diabetes at the age of 55-65. Why is that happening? Too much of partying, too much of restaurant food, too much of carbohydrates in our diet. And all that is messing up our system.
I have so many questions. I'm going to break it up into these 5 pieces.
Sure.
You said too many carbohydrates. And one of the, there are right now 2 schools of thought. One of it, as far as our diet is concerned, one says you need to be eating more protein because as a country, culturally, we don't consume enough protein. Even the non-vegetarians, which is a very Indian term, right? Nobody else says non-vegetarian in the world. Maybe eat chicken once a week, which might not be enough. But there's the other school of thought that says eat whatever your ancestors ate.
Absolutely.
Which was the full Indian thali. From the point of view of keeping our hearts healthy, which one works better?
Nice question. So I'll answer that question in 2 different directions. One is, if I analyze my last 100 patients who underwent a bypass surgery, 90% are vegetarians. Only 10% of them are eating non-veg. Oh. So am I saying that in India, vegetarians are more prone to coronary artery disease? Answer is emphatically yes.
Okay.
Why? Because the choice that a vegetarian diet has is very limited. So what they do to make it attractive and tasty, fried this, fried that, garlic bread naan, fried this, butter naan, fried this, dal, fried dal. They go to a restaurant, exactly do the same thing, fried this, fried that. So they are ingesting pure carbohydrate and laden with all third class of fats, because the cooking medium which is being used in restaurants is not the best. So in India, this is a very different problem. So the answer to your other part of the question is that if you're born in a non-vegetarian, so-called non-vegetarian family, eating meat is good. Oh, eating fish, easily the best. There's no debate around fish. So long you're not eating too much of shellfish like prawns, lobster, crab, and you're eating a regular seawater fish, absolutely best choice of meat. What about lamb and what about chicken? Now, unfortunately, chicken in our country is full of female hormone. So what does the butcher do? He buys a 5-day-old chick, feeds it with feed which is full of hormones. So 6 weeks later, that chick is 1.5 kilo in weight. And so today we are ingesting chicken meat which is full of hormones. What about mutton? Very interesting. So when you look at mutton worldwide, it is the sheep which is eaten worldwide. But in our country, we eat goat. Now, this goat is hardly been fed anything. So, the goat meat in India is actually very lean. And so, it is a good form of red meat because it doesn't have too much of fat, it doesn't have too much of cholesterol. So, goat meat, especially the shoulder piece, is actually healthy.
Okay.
What about eggs? Eggs are a very good source of protein, especially for the youngster, especially for a growing up child. But once you cross 20, more than one egg yolk a week is actually a sin. I repeat, eating more than one egg yolk a week is sin.
Why?
Because one egg yolk is so much of cholesterol. It's full of LDL cholesterol. It's just wrong. So you have to eat only egg white. Period. Period. There's no debate on it. But nobody tells us, nobody talks about this. I'm ensuring tomorrow morning you cook yourself an egg white omelette and you will fall flat for it. It is that tasty.
But there's this whole idea now that we have to consume a certain amount of protein compared to your body weight, and the way to achieve that is to eat a lot of eggs.
Egg is a good source of protein at a very nominal cost. Eggs are very good for growing up children. So, how much protein is the right amount of protein? Very simple answer. So, if you are in the age group which is still growing, that means say from 5 years to 15 years or 20 years, you should be eating 1.25 to 1.5 gram per kilo body weight. So, for example, if the kid is 20 kilo in weight, he or she should be consuming 30 grams of protein. But once you grow up and you are across 20, then 1 gram per kilo body weight. So, for example, a 50 kilo patient or person should be consuming 50 grams of protein a day. More, is it better? Yeah, but it comes at a cost. If somebody is consuming too much of protein, then you are putting too much of load on the kidney. And God forbid, tomorrow you develop diabetes or any other condition which is going to provoke kidney disease, then having consumed that much of protein will now start damaging the kidney. So you have to stay balanced. The answer is moderation in everything is the right way. Don't go overboard with either. Carbohydrates is bad news, yes. If somebody were to ask me what I would give up, no chapati and no rice. But then it becomes a very radical statement. Well, our food revolves around bread and rice. And if you see the Western food, which just meat and salads, and there is no carbohydrate. They take a small piece of bread. That's the correct diet.
But you did say, of course, one of the problems with vegetarian food in India is the fact that it's all fried. Is seed oils an issue in your mind? We have a lot of traditional oils in India. We have coconut oil, we have mustard oil. Are seed oils a problem? Is all oil a problem?
Frankly speaking, all the oils are a problem, and that is broadly speaking, yes. Oil is bad news, fat is bad news. So within that bad news, is there something good? Answer is clearly yes. So by and large, any cooking medium, any oil which is used in cooking, if it is going to solidify at room temperature, that means it will solidify inside your coronary arteries as well. So coconut oil, bad news. Butter, obviously bad news. Dalda, bad news. So coconut oil, clearly no. Clearly no.
The entire state of Kerala will disagree with you.
That's right. Yes, they would disagree with me, but they also
Okay, so
have.
let me ask this question. Doesn't our body maintain a certain temperature? It's not room temperature. It's not going to solidify like it would in the fridge.
No. This is just a statement to make people understand.
Okay.
So basically, it denotes that this is saturated fat. So anything which is solidifying right under your eye, it is saturated fat, and saturated fats are very bad. So what is the best cooking medium? So come to the point. The best cooking medium is like sunflower oil. Excellent. One of the best oils to cook is sunflower oil. Second one is corn oil. So corn oil is also actually very good.
Okay.
Rice bran oil, still okay. What is the best thing to do? Rotation. 2 months you consume sunflower oil, followed by 2 months of corn flour oil, and then 2 months of rice bran oil, and again going back to that. And a monthly consumption of 1.5 liters for a family of 4 adults per month. 1.5 liter cooking medium for a family of 4 adults per kitchen per month.
Ghee?
Ghee. Goodness gracious.
Now we're very dangerous territory now.
I am a cardiac surgeon. To cardiac surgeon, ghee is like repellent. No chance.
No chance.
Second is saturated fat. So no saturated fat, any cardiologist or cardiac surgeon will say yes to. So there are a lot of Gujarati patients and other Indians who ask me, can I just put, so no more than 5 grams of ghee just to be applied on a chapati just for taste.
Yeah.
But ghee in general is harmful.
Are we genetically predisposed as Indians to heart disease or to obesity or to even what they call skinny fat, which is basically the whole body is skinny but just as a pot belly? So is this the way we're living our lives today, or is it genetically as South Asians that we're predisposed to this?
So genetically, Indians do have tendency for a pot belly. So you can have a lean man on the road and still he has a belly. You look at a white Caucasian in the United States, 200 kilo body frame, no belly. So belly is clearly genetic. Number two, the colored race, very predisposed genetically to developing diabetes at a young age. So moment a person who is eating wrong food is likely to develop diabetes while they are in their 20s. And we are seeing this. And moment you have diabetes, heart disease is not very far away. So this is all genetic. Answer is, in the broader picture, what is facing us? Genetic mismatch between what we want and what our body is. Yeah, we are predisposed genetically to early onset of diabetes, early onset of hypertension, and to belly.
And obviously diabetes and hypertension, either or together, leads to heart disease?
Absolutely. Absolutely. What diabetes does for heart disease is the worst possible. Why? Because if you see the Western patient, they have very big coronary arteries and their blockages are very discrete right at the origin and the rest of the arteries are very clean. In India, we see arteries which are diffusely diseased. So you have multiple blockages all around till the end of the road, till the end of the artery. That's because of diabetes. The other thing that diabetes does is it impairs our lipid profile completely. So it is so typical in our patients, lean and thin fellow, 40 kilo, 40-year-old, weight is 40 kilo, but his triglyceride level will be 500 and yet his cholesterol will be only 175. It's all because of genetic, all because he's got diabetes and he's obviously consuming Indian vegetarian food.
I mean, we did talk about carbohydrates and fat, we didn't talk about sugar.
Yeah.
How much do you worry about sugar? How bad is our abuse of sugar right now as a society?
So medically speaking, sugar is again part of starch and part of carbohydrate. Sugar is the biggest capital no for me. If ghee is no, sugar is at the same level no.
What screening should we be doing of different age groups, the 20s, 30s, 40s? How often should we screen? What should we be looking at? What tests will tell us whether our hearts are okay?
From the larger society's perspective, this easily is the most important question to be asked. What's the screening at what age and what frequency? Yeah. When you turn 20, that's the stage, we must rule out all the genetic disorders. So a good doctor can do screening of a lot of tests and that's the right age to do. What about heart? So if you want to rule out heart defects as in birth defects, that means congenital heart disease, that screening should have been done in earlier childhood by the pediatrician and every child should have had an echo done when they were very small. Yet, a lot of birth defects in the heart actually get diagnosed in our country in the age group of 20 to 50, which is a sad reflection, but okay, not a problem. As far as the acquired disease like coronary artery disease is concerned, I think if you have a family history of heart disease, meaning either of your parents have had angioplasty or a bypass or a heart attack, then the first year when you should get screened is the 30 age group.
Okay.
If your parents did not have any heart disease and you don't have diabetes, then 40 is the right age to screen first. So what is the best screening test? A combination of exercise stress test and a 2D echocardiography if you do, and if you still have money spent on a lipid profile, then these 3 tests are mandatory for every Indian at the age of 40.
How often, Doc?
Good question. So very simple again. If you don't have a genetic background, meaning your parents didn't have heart disease, then after that, every 4 years till the age of 50, and then every 2 years till the age of 60, and after 60, every year.
Every year. And these blood tests, the cholesterol, triglycerides, HbA1c, blood pressure, how often would you have us do these?
So, blood pressure is a disease which itself does not cause any symptoms. It remains undiagnosed and untreated. And it actually happened to myself as well. I knew my mother had hypertension, but I said, I'm fit, I jog, I do this and I do this, I'm working night and day. I was taking pride in the fact that I was working 19 hours a day till 5 years ago. And I used to take pride in telling the world, 18 to 19 days, 19 hours of work out of 24 will keep you healthy. One fine morning, my anesthetist said, no, let me check your blood pressure. I said, no. And he said, no, let me check. And so, just before starting the operation, this was at Hinduja Operation Theatre about 9 years ago, my anesthetist took my blood pressure for the first time in my life. And my God, I had shock of my life. I had a blood pressure which was sky high. So then, you know how we all are. I said, no, I think the next operation is very difficult. Maybe I'm just blood pressure. He said, no, I've been noticing that you are increasingly getting angry at short bursts. So that's why I decided to do a blood pressure check. And sure enough, the blood pressure stayed at that level the whole day. And then I had to start treatment. And that's not good. It happened to an educated surgeon practicing in Mumbai, practicing in a reputed hospital like Hinduja. So imagine what can happen to a common man. So blood pressure screening is absolute mandatory, especially if your parents have had high blood pressure. So that age group can be as early as 30. And hypertension is actually more common in women. So I would definitely say every housewife, after she becomes a mother, get a BP check once a month.
Specifically housewives or all women?
Once you become a mother.
Okay.
Because a lot of ladies, they don't have hypertension, but when they are pregnant, they tend to develop high blood pressure.
Yes.
And some of them then will continue to remain hypertensive.
Also, there is a history of women presenting with heart attacks differently. Their symptoms look different. And so when they go to the emergency room, a lot of times the doctors don't really check them for heart disease. Absolutely. So for women, what should we do to make sure our hearts are healthy? And also, what are the symptoms we should keep in mind?
Yes. So coronary artery disease and the woman is an absolutely different chapter in our books. It's completely different. Why? Because we were all taught that while the female is still menstruating, the female sex hormone levels are high, so that protects her from developing coronary artery disease. Once menopause sets in, then both men and women are equal. So if you have a predilection for getting heart disease, you are going to get it. So we always believed in this. And so automatically a doctor would ask, are you still getting periods? She would say, yeah. Then we would assume she can't get heart disease. But now we are realizing that's not correct.
Okay.
Yeah, that's not the case. So, but while the women are menstruating, they are protected and says yes. But today, because of so many other factors, like lots of atmospheric pollution, lots of wrong diet, onset of now diabetes at a younger age, women becoming obese because they're not looking after their health, no exercise, hardly any Indian housewife is doing exercise. So this is provoking heart disease in them. So today, all the casualties, especially good casualties like Hinduja, are told, don't worry whether the patient is a female or a otherwise. Treat her, if you think this is heart, treat her as heart. Just don't think that she's a 40, she's still menstruating, she can't have a heart attack. And believe me, we are seeing young females coming with heart attacks at the age of 35 to 40. You feel very traumatized because you can see there is a 8-year-old boy looking at me with a lot of concern and anxiety, and it's not a nice feeling. I can't tell a boy that, look, your mother just had a heart attack. It's not a nice thing to do.
What does a heart attack look like? For, how do we know that this person's having a heart attack? It's not just acidity or,
Like, obviously, somebody who's getting a heart attack for the first time never experienced that symptom. So the poor guy says, I had this for the first time and nobody had taught me that this can be heart attack. So I sat over it. And this is a question and answer every day in the clinic, every day in the casualty happens to me. I said, yeah, you didn't have this. Sure. So symptoms of heart attack can vary from 0 to 100. 0 is no symptom. I just woke up not feeling great. I don't know why. I slept reasonably well, but I was not feeling great. And I was having discomfort in my chest. I said, no, I think I had too much to drink last night. And that spicy food that in the restaurant was not good. No, don't ignore this. So he ignores this. Now he is walking to the bus stand and realizes that that chest discomfort is actually getting worse. So any chest discomfort which is getting worse on walking on or exerting is heart symptom. Why? Because you have an injured heart, you have had a heart attack, which you have missed, no problem. But moment you will walk, it will exaggerate the pain. Yet you can have what is called a completely silent heart attack. And a completely silent heart attack is very common in people who are diabetics. So a diabetic patient can be sitting like that, experience a chest pain. He is not feeling the chest pain, but he will start perspiring. And everybody will say, yeah, AC come hai. No, AC is good. He is perspiring. This is heart attack. So the level of suspicion should be high, especially if you are vulnerable. That what is vulnerable? Your parents had heart attack. Your father or mother had a bypass surgery, or you have become obese, or you have been consuming tobacco in any form, or your sugars are high, but you are not accepting that you have got diabetes. You meet a patient, oh, my sugars are high, but I'm not diabetic. Because people are taking label of diabetes as a stigma in our society. Women I say, you got diabetes? No, 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 I don't have diabetes. I've got, sugars are high, but I'm okay. So we want to, but yes, you can have a genuine patient where
So when you have pain of a heart attack, is it a burning sensation pain or is it discomfort like indigestion?
So when a patient will experience actual pain in the chest, it's like somebody is stabbing into your heart. It is excruciating. It is excruciating. It's like a dagger being thrust into your chest. It's very painful. Yeah. So that symptom is difficult to ignore and difficult to sit on. But unfortunately, that does not happen always.
Yes.
And a lot of the time, the pain is more subdued. But we are responsible people. We should also realize that no, let me check it out. My life is very precious. I'm answerable to my family. I'm raising a family, or I'm a surgeon, you're an executive. So we need to be very over the top. That means if I'm having discomfort, let me get the heart attack ruled out, because that's one condition that is easily treatable.
How do you get a heart attack ruled out?
Good question. So if you start doing exercise on a regular basis, you're consuming the right drugs, right diet, and you are screening yourself every 2 or 4 yearly from the age of 40, then the chances that you will miss out a heart attack is actually quite less. So that is the advantage of screening. But it can happen even to the best of doctors, that you are a doctor, you may be a cardiologist, but you can still miss a heart attack. So what happens in a heart attack is very important to understand. So what is a heart attack? So each time I ask a common man, and I see patients every day, do you know what is a heart attack? So somebody said, oh, I had a cardiac arrest. Then I have to obviously smile. So cardiac arrest and heart attack are poles apart. There's nothing in common. So what is cardiac arrest? That means somebody's heart actually stopped. So it is the event in life seconds before death. So if the heart stopped and continues to remain stopped and no intervention is done like a CPR, cardiac massage, then you are dead. So that is an event just prior to death. That is different. Heart attack is death of heart muscle. So when one of the coronary artery gets blocked, blood flow stops to that part of the heart and heart muscle just dies. So the dying heart muscle causes the chest pain. Dying heart muscle will liberate chemicals. How? There will be a dead rat or a dead cow, it will emanate foul smell. Similarly, a dying heart muscle liberates a chemical, troponin it is called. So this test takes 20 seconds to get the result. You go to any casualty of a reputed hospital and they are suspecting a heart attack, they will do a ECG, they will do a troponin test, so we call it tropi, and within 20 minutes, you have a report, negative, positive or high, decide. So that tells you heart attack. So today diagnosis of heart attack is very simple, very commonplace, and can be done even in a village.
Okay.
So gone are the days that you are in a remote part of India and they could not diagnose heart attack. I'm not ready to believe it.
Would you be able to tell us the difference between the different types of treatments? So there's the bypass, there's the angio, there's the stent. And I know I'm approaching the favorite part of your conversation. I said it's fine. So when someone does come to the emergency room and the emergency room has established that this person is having a heart attack, what happens next?
Yeah. So we have a gentleman or a lady who just walks into a good hospital. Casualty doctor says heart attack. So the protocols are very straight nowadays. So the first thing that we do in a reputed hospital is angiography.
Okay.
So immediately the casualty doctor will call up the cardiologist on duty, and that cardiologist will reach the hospital within 20 to 30 minutes. Cath lab technician is on standby. He will open the cath lab. Cath lab is switched on. This gentleman will have some blood tests done. The reports we don't wait for. So even hemoglobin is done, but we don't wait for the hemoglobin to come because time is essence. So you bring that patient from the casualty to the cath lab table and an angiography is performed. Moment an angiography is performed, the cardiologist will be able to identify that out of the three coronary arteries, we have three coronary arteries. Out of the three, which one is the cause of the heart attack? So the cardiologist will there and then open the artery. So we call in our language open the artery, but medically speaking, it is called PAMI, primary angioplasty during myocardial infarction. So you open the artery which was causing the heart attack. So the blood flow will be immediately restored. So the size of heart attack and damage would be minimized and you could still be left with a heart which is not yet injured because you managed to open the artery. And so you here have a patient, no damage done to the heart. Yes, you had a heart attack, but we salvaged you. So he or she then will have an excellent quality of life. So majority of the times PAMI is possible. When I say majority, I say 90% of the times. But there will be some patients where PAMI cannot be done because of the type of disease, or we do PAMI, but there are other blockages to be tackled. So after doing PAMI, PAMI is primary angioplasty, we wait for 3 to 4 weeks till the patient is settled down, and then we evaluate the angiography all over again. So it is seen by the cardiologist, by the cardiac surgeon, and then we counsel the patient that, ma'am, you got blockages in all the three arteries. We salvaged that artery during the heart attack, but you know other arteries are not amenable to a angioplasty, then you should have a bypass surgery. But today, 2026, first line of treatment is angioplasty. So irrespective of what you see, if an angioplasty can be done, even though I'm a surgeon, I'm still stating this. The common man thinks you go to a surgeon, he will always say surgery. No, it's not like that. So first line treatment is always the angioplasty. So angioplasty is same as stenting. So when angioplasty started long time ago, in the late 1970s, became popular in India only in late 91s. We were doing only what is called a balloon angioplasty. So there would be a narrowing, the cardiologist will bring in a balloon there and distend the balloon, and so the block would get pressed out, and so you would have a clear lumen. But then we realized that the blockage would come back very rapidly. So then we started deploying stents. And then initial stents were made of metal. Then we started deploying metallic stents, but with covered with drug. So they are called drug eluting stents. So today, drug eluting stent is the gold standard.
Okay.
Why? Because the restenosis rate is dramatically dropped. So today we have patients who had drug eluting stents done 15, 20 years ago, and the stents are wide open, patient leading good quality life. So clearly for coronary artery disease, angioplasty remains the first line treatment. So which is a great case for angioplasty when one or two arteries are having blockages and the blockages are very discrete. Discrete meaning the length of the blockage. So if this is the artery, the blockage length is that big, that is diffuse disease. But if the disease is located only 1 or 2 millimeters, that's called discrete blockage.
Okay.
So they are very amenable with good outcomes with angioplasty. So which is the patient who comes for surgery to us? So the patients who come for surgery to us are very different. These are patients who are obviously more sicker. That means they've already had a heart attack, their heart functions are down, and the expected anticipated lifespan is gone down. So those are patients for surgery. Patients who have diffuse disease, patients where all the arteries have blockages, patients who have got left main coronary artery disease. So these are patients where bypass surgery is indicated. So compared to 35 years ago when we used to get very nice cases, Today, the surgeon is faced with very difficult type of cases. Heart functions are poor, arteries are very bad, full of calcium. So it's a struggle for the surgeons. But then as you become senior and as you become experienced, you are able to handle that. But yes, surgical patient today is way different and way more difficult to what it was 35 years ago.
What is a bypass surgery? What happens in a bypass surgery?
So why is it called bypass surgery? Let's start with the basic question. So this is an artery, blood is flowing from here to there. There is a blockage here. So what the surgeon does, he creates a channel like a flyover from this spot to a point beyond the obstruction. So you now have a new channel. This new channel has to be part of body. So it has to be a tube coming out of human body. It can be a vein removed from the leg, but those are very few nowadays. So we take out what are called arteries from the body. So behind the sternum on either side, there are two arteries. They're called IMA, internal mammary artery. So these arteries never get blockages themselves. So we make use of those two arteries to do all the bypasses. We can also use the artery from the forearm. It's called the radial artery. And this is also arterial graft. So nowadays patients are getting more and more arterial grafts because the durability of arterial grafts is very long. So if a good surgeon does good surgery with arterial grafts, patients can live on for 30 to 35 years without the need for a repeat surgery.
Do you have a lot more patients coming now with comorbidities that you have to be careful about? You did say that the cases are becoming more and more challenging.
Yes.
Is that because when you get a case of someone who has diabetes, someone who already has high blood pressure, they have other issues, what is the challenge like for you?
So we were doing analysis of our work at Hinduja over the last 35 years. So from 1991 to 2000, first 10 years, I had done 6,800 cases. And the incidence of diabetes in that group of patients was only 10%.
Oh,
Today, the incidence of diabetes is almost 50% in bypass patients. So 40% increase in 35 years. Number two, what is very interesting is the incidence of smoking went down. 91 to 2000, 50% patients were smokers. Today, smoking has gone down, which is good. What has gone bad? People started chewing tobacco. So the incidence of chewing tobacco is far worse than smoking.
that's okay.
Yeah. Obesity, 91, obesity was so much less in our country. And 35 years later, I look at every Indian to be obese. And our patients are, my heaviest patient is 158 kilos. And you have to do a bypass at 158 kilos. It's not easy. So it is a major problem. So yes, comorbidities in the last 30 years tremendously increased. Diabetes, hypertension, obesity, COPD. Then lot of patients after COVID unfortunately have lungs which are damaged. So those are not very great patients you'd like to operate because they sometimes tend to get stuck on ventilator in the post-operative period. So COVID was very bad for the lungs for sure. So those patients, when they come for surgery, you don't have a nice feeling about it because we know post-operative would be a struggle.
Is there a connection between COVID and increased heart disease? Because there was a lot of buzz about, is it because we took the vaccine? Is it because we had COVID? People are dropping dead at 40. What have you been able to establish anything?
This question obviously is being asked to all the medical fraternity almost in every forum. Firstly, there is no scientific evidence. So clearly, there is no proof of it. What about the vaccine? No. The two vaccines that were used on the Indian population, none of them will cause coronary artery disease. So there is no truth.
Yeah. Has there been independent research done to establish that?
No, because while the COVID epidemic was on, obviously lives
At
were
that
being
time,
lost.
at that time they couldn't have been, but
we could
it's
not
been
do
6 years
So we could
since.
not do a prospective study.
Yes.
So any research which is done prospectively is scientifically more accurate. When you do a retrospect, then it is not. Because a lot of people who thought they had COVID may not have had COVID. And a lot of people who never thought they had COVID actually had COVID. So now that is also a difficult question. But scientifically, there is no evidence to believe that either COVID or the COVID vaccine would provoke heart. So we are very clear that that is not a factor. What is a factor? If the lungs got impaired, then those are the patients. So today, incidence of lung transplant is rising in India. because those are all COVID survivors. And some of them have been left with very badly damaged lungs.
What questions should one ask a surgeon before heart surgery?
Important questions to ask a surgeon are very simple. Number one, would it prolong my father or my relative's life? And if yes, how much? Will it have any negative impact on the quality of my father's life after bypass surgery? If yes, what? Number two, what extra precautions and what drugs I must ensure that he continuously takes after surgery. After all, taking antiplatelet blood thinners and taking cholesterol medication is mandatory after bypass surgery. So that is extra burden of cost also. So those are the questions which are more relevant.
Right.
But the question which should top the list is, can my father or my patient still get a heart attack after a bypass surgery? Very simple. Correct? Even your eyes lit up. Answer is, yeah. Oh, I'm so disappointed to hear this. So all the books continuously in the last 50 years have mentioned that bypass surgery and angioplasty, but bypass surgery more, protects the patient from fatal AMI. So you will not get a heart attack which will kill you, but you can get a small heart attack once in a while, but it won't be fatal. So the bypass surgery protects you from getting a fatal heart attack, but a minor heart attack can still happen.
You did say, of course, that instances of obesity have really shot up in our country recently. Do you see GLP-1 drugs as a solution, especially as a cardiologist? Do you see this as a solution for our society, or is it likely to make things worse?
I just gave a talk on semaglutide,
Yeah.
another anti-obesity drug, only 5 days ago, and I'm a surgeon. So there were top physicians in the audience. You're a surgeon, how come you decided? I said, no. In last 30 years, I was waiting for a day when a miracle drug will happen. And the first miracle drug in my own lifetime happened about 20 years ago when a drug called Arni came. Arni is a drug which you use for heart failure.
Okay.
So till 20 years ago, there were no drugs for managing heart failure, and heart failure is a very common problem. But when Arni came, I said, wow, this is like God has come himself. And Arni made big revolution. And today, Arni is a money spinner for the pharmaceutical company, but forget the money part. The patients are living longer, much better quality because of Arni.
Okay.
So Arni was a magic. And the next big magic that has happened now is the drug that you talked about. So these drugs, though, are primarily for diabetes, but majority of these patients are anyway having obesity. So these are excellent drugs so both drugs, Mounjaro and semaglutide with various brand names, they are excellent drugs. They are here, and they are here for a very good cause. These drugs are magic drugs, but they should be taken under supervision. Because losing 5 kilo weight is not difficult, but losing 5 kilo weight and maintaining that lost 5 kilo is the key.
Yes.
Because all of us will get, after I meet you, I'll be very motivated. You meet me, you will be motivated. But the question is, after 3-4 months, that motivation level goes down. And then everything comes back. So the problem with these drugs is, moment you will stop the drug, the weight will come back with a vengeance. Because your level of motivation also has gone down. So you have to have a very good clinician supervising you with the drug.
Is there enough research to tell us what happens when the drug is stopped? Or is there a possibility, in your opinion, of people taking the drug indefinitely?
What will happen when you stop the drug? Weight will come back with a vengeance? Answer is yes. What will happen to your diabetes? It will also go back very high levels unless you institute another line of drug.
Okay.
So the answer to your larger question is, once you start anti-obesity drug, and suppose you have a target, I will lose 10 kilos, then you can start reducing the amount of drug that you're taking. Most of the time, this drug is given only once a week in the injection form.
Yes.
And so you can start reducing from, say, 2.5 milligram downwards and try to manage with the minimum amount of drug. But the clinician is required and your family support is required to maintain the level of motivation. That's the problem. Motivation goes down. Oh, now, I am 55, I couldn't care less. That's not a correct diet.
Because there's also data to suggest bone loss and muscle loss
Good question.
along with the fat
Yep.
loss, which
You are well read. So, this is a question often asked to me. So, what happens to bone loss and weight loss? Weight loss, is it fat loss, muscle loss, or both? Answer is both. So, we have very clear evidence that there is muscle loss as well. So, while you are losing weight, fat is being lost. So, we always recommend that you continue doing weights to at least minimize the amount of muscle loss. As far as bone loss is concerned, that is more dietitian, more related to the diet, because we are now trying to cut down on our weight. So, most dietitians will tell you don't take dairy product. 85 to 90% of the population is vegetarian. The only source of calcium in a vegetarian diet is milk.
yes,
So, all those people who are stopping milk consumption and while being vegetarian, they will always develop osteopenia. That means loss of bone, calcium. So, a vegetarian fellow can never stop milk. A non-vegetarian diet, there is enough calcium in meat, so you don't have to worry about milk. So, answer is yeah, that you have to be careful. That means when you are on weight loss drug, do you need to take these supplements? Answer is clearly yes.
yes.
You have to look after your bones. Yes. You have to look after your muscle. Yes. You have to do certain weights to keep the muscle going.
If there was, in your opinion, the biggest myth that Indian society has about heart disease, what would that be? If you could clear something up for us.
People think once they have a heart attack or they have had a bypass surgery, it is the end of life. No, that's not correct. Every individual after angioplasty or a bypass surgery or a heart attack can lead a very meaningful, very purposeful life with full of achievements. Believe me, it is not the end of the road. But I see a lot of patients and families absolutely heartbroken. They go into depression. Ab kya ho gaya? Khatam ho gaya. No, it's not the end of the road. You can lead a perfect. So there are so many presidents and prime ministers all over the world who have had a bypass surgery and come back and become very successful prime ministers and presidents. There's so many industrialists. There's so many actors whom we have operated upon. Obviously, I can't take names, but they are able to lead a normal life. We have pilots who had surgery and lead a normal life. So it's not the end of the world.
It's not the end of the world. And post recovery, what are the broad strokes of taking care of someone who's been through surgery?
First and foremost is that this particular family in whom a individual had a bypass surgery, that family at least should become a role model for exercise, for diet, and for leading a very disciplined life. Because then the rest of the world will see, oh, the husband had a bypass surgery, but the whole family has changed for the better. They are the role model. They're exercising. They're going for walks. They started playing sport. They're so health conscious. Not eating junk food. So, but bringing sport and exercise into each individual Indian life is the loudest message I can give. You got to play sport. You got to play. You got to be fit like a fiddle.
Doc, what is the difference between a cardiac arrest, a heart attack, and heart failure?
Actually, all three are quite very different. Heart failure is a condition where the heart is not able to pump sufficient amount of blood for the needs of the body. For instance, a normal human being of our size, the heart is pumping 5.5 to 6.5 liters of blood per minute. But you can have a heart function which has been deteriorated from a previous heart attack or so many other conditions or a valvular heart disease, and the heart function goes down. So now this heart is able to pump only 3 liters of blood per minute. So what happens to the rest? That gets congested in the lungs. So this is heart failure. That means the heart is not able to pump sufficient amount of blood for the needs of the human body. And that will result in breathlessness and it will result in swollen limbs, swollen legs. As against that, what is a heart attack? Heart attack is death of heart muscle because the coronary artery closed down.
Yes.
And what is cardiac arrest? Oh, heart stopped, and if you don't revive the heart, this will result in death. So those are absolutely three different words.
Since you talked about surgeries that keep you up at night, we talked about all of the other factors. We didn't talk about sleep and stress. Let's assume I do everything by the book in terms of diet, in terms of exercise, all of the things that you said. But if I'm experiencing a lot of stress and I'm not sleeping enough, And we could debate as to what enough is in this context. What happens to the heart?
Your statement is not debatable at all.
Okay.
If you can't get good sleep, it's bad news.
Hmm.
It is bad news. So people like me don't get sleep, and that is why this happens. This is purely related to the fact that you're hardly sleeping for 2 or 3 hours, and rest of that, when the world is sleeping, you're still thinking of, I did this, I did that, I could have done this, I didn't do that, and so you're fighting with yourself. And not good for health. Believe me, a sound sleep for 7 hours is mandatory, and a lot of us are unfortunate in that regard, that your body doesn't allow you that. And I don't want to resort to sleeping pills, and I will never definitely recommend to the society, don't resort to sleeping pills. But yes, sleep is mandatory. You must have good sleep. Stress is something which is very difficult to quantify. Why? Because how you handle the stress is actually the key. If you can't handle the stress which came in your life, that's not good. But if you are able to handle the stress, and believe me, some amount of stress is required if you want progress in your own life. If I have a life which has no stress, then I will become redundant. I will have no reason to progress in life. So I rather want to have progress in life. That can be at the cost of stress. Fine.
All right, doctor. Thank you so much for speaking with me
My
and
pleasure,
answering all
Dr.
of my questions. Thank you.